Hello student, good afternoon. Today we will discuss on general characters and classification of Calotes. External characters of Calotes. That is the morphology. Calotes. The external characters of Calotes. Calotes is the common garden lizard. It is diurnal, arboreal, and insectivorous animal. Mid-dorsal crest of spines, trunk, scales, neck, tympanum, head, eye, nostrils, mouth, claws, finger, thigh, orchium, hands, antebrachium, forelimbs, hindlimbs, claws, toes, foot, shank, tail, trunk, scales. All these the morphological organs of this Calotes. External characters. Body is elongated, slender, and divisible into head, neck, trunk, and tail. The entire body is converted by rough epidermal horny scale of unequal size. On the head, prominent shield covers the parietal foramen, and two spines are present above each ear openings. On the head and trunk along mid-dorsal line is a crest of large spines. Skin is dry and without glands. Head is large, pyramidal in shape. The conical snout bears a wide terminal mouth and pair of oval external nards. Each eye is provided by movable eyelids and nictitating membrane. Behind each eye is an external ear opening covering with tympanum. Trunk is laterally compressed but flattened ventrally. It is connected by a short neck. Cloacal aperture is slit-like, ventrally situated in the between trunk and tail. There are two pairs of limbs. Hind limbs are longer than the forelimbs. Each forelimbs bears branchium, manus, and 5 claws figures, while each hind limbs bears femur, crush, pies, and 5 claws toes. Tail is longer than the head and trunk. It is cylindrical and tapering whip-like. The tail shows dark and light annuli. In adult male, the base of tail just behind the cloacal aperture becomes mildly swollen due to the epipenis. Male is brightly colored golden yellow with greenish tinge. The male is stronger and larger than female. Sexes are separate and difficult to distinguish externally. The respiratory system of Calotes. The respiratory organs of Calotes are a pair of lungs. Two lobes of lungs are present in the Calotes lungs. The lungs are situated in the thoracic cavity on the sides of the heart, dorsal to the liver and ventral to the stomach. These are elongated the wall sacs of the orange color. The inner surface of lungs has a network of ridges enclosing shallow depression or alveoli. The ridges are numerous in the anterior part of the lungs, forming circulated wall, while absent of the posterior most part of the lungs. Thus, each lungs is incompletely divided into two parts: in the anterior part of respiratory part with highly vascular circulated walls, and a posterior part with smooth not highly vascular walls having mainly the functions of a reservoir. The volume of the lungs is relatively larger than in mammals, but the surface area is somewhat as much as 100 times smaller in proportion to the weight of body. The large volume provided as a reservoir of air useful in dividing species, but also for the long period of holding breath when started and so remaining still in aqueous species. The lungs also provide buoyancy and are then often increased by smooth avascular air sacs. Mechanism of breathing. The type of mechanism of breathing is due to backwards movement of the ribs produced by the muscles attached to them. These muscles are intercostal muscle. When the ribs are raised and carried backwards, the pleuroperitoneal cavity is enlarged, causing the lungs to expand and produce a long pressure in them. Atmospheric air, which is present at a higher pressure, immediately rushes in to fill the lungs. Inspiration. When the ribs are lowered, the pleuroperitoneal cavity and the lungs are compressed, resulting into the parietal partial emptying of lungs. Expiration. In most reptiles, the pleural and peritoneal cavities communicated, but in crocodiles they are separated by a kind of diaphragms and the diaphragmatic muscles running from the liver to the pelvis, assistance in respiration. Blood vascular system. The heart is triangular organ consisting of a sinus venous on the dorsal side, two auricles anteriorly and one ventricle on posterior side. The ventricle is attached to the posterior pericardial wall by a ligament which appeared a remnant of the ventral mesentery. The sinus venous is triangular, thin wall chambers on the dorsal side of the heart, lying transversely above the auricles, to the right of which is closely attached at the two anterior end of the sinus. The precavals enters posterior apex of the sinus, receives the large postaval vein. The sinus opens into the right auricular opening, which is oval and is not guarded by any wall, but its lips are thick and muscular and are thus kept closed except when the blood is forced through it into the right auricle. The two right and left auricles are externally separated from the ventricle by a coronary sulc. The right auricle enlarged than the left. Internally, the two auricles are separated into two chambers by a complete interauricular septum. The interauricular septum reaches the auriculoventricular aperture, dividing it into right and left divisions. This opening is guarded by the auriculoventricular walls attached to the posterior free end of the interauricular septum and consisting of two semilunar flaps, one guarding the right opening and the other the left. Into the smaller left auricle opens the pulmonary vein by a circular pulmonary aperture. A forward lip-like outgrowth of the dorsal wall of the auricle guards the pulmonary aperture. The opening of the ventricles bears a small outgrowth, gubernaculum cardiac, connecting tuberculi with a relatively small central space. Thus, the wall appears to be spongy. Into the meshes of sponges work in the interstices. The blood can enter for a considerable distance. The dorsal and ventral wall of the auriculoventricular wall and the attached by the muscular bands to the dorsal and ventral walls of the ventricle, thus forming an incomplete septum dividing the ventricles into two chambers, right and left. Of these, the large right is the right of the partitions arise the pulmonary arteries. The right aortic arc arise from the left of the partition. The venous system of Calotes. This venous system is we will be continuing in next lecture. Today this is external characters of Calotes and respiratory system of Calotes we have to complete it. Okay, thank you.